Something that many people email into us about is how to make a vet visit go as smoothly as possible or to help their dog overcome fear of the vet. In this video, we're going to talk about how to help your dog have the best vet appointment possible for both you, your dog, and your vet team. The most important thing we can do is to be prepared. If we know that the vet is not always a good experience with our pup, we want to make sure ahead of time that we are fully prepared. Know when your appointment is and start getting ready early. Maybe even make a checklist of what you'll need. Bring a variety of treats, and if your dog is conditioned to wearing a muzzle, bring that along too, just in case. It's better to keep everyone safe and have us put a muzzle on that our dog is familiar with than to have to use a veterinary provided one when our dog is already stressed out. I'd also make notes before you leave about what you're discussing with the vet. That way, even if something happens and you get flustered, you won't be missing anything that you want to discuss with them to make the most out of your appointment. I would advise as well, for anxious and/or reactive dogs, leaving them in the car when you arrive. Go check in with the vet clinic and see if you can come to an arrangement where your pup can either wait in the car until a room is ready or you get to bring your dog right into the room. Many vets understand that the waiting room may not be an option for all dogs and will be willing to help things go as smoothly as possible, especially since it'll make their job easier too. You may also want to provide your vet with treats you have, especially high-value ones, and have them feed your dog if they do not offer to do this on their own. Some vets have even begun using their own lick mats or products like squeeze tubes during appointments to help keep your pup occupied. Bringing your own lick mat or squeeze tube is a great option if your vet does not offer this, or if you have special dietary needs or allergies for your pup. These not only will be able to help keep your dog busy, but licking is also a calming activity as an added bonus. Working on training itself to reduce stress in future at the vet can be challenging, as we would have to go to our vet clinic and work on this regularly. If your vet is very far away and your dog rarely goes to the vet except for vaccinations, for example, this might not be the best use of your training time, and you may want to work on other things and focus around management at the vet. However, if your vet is very close and/or your pup has a medical condition that requires frequent visits, this may be a training priority for you. In this case, you'd want to talk with your vet and get them on board with a training plan to work on visits to do counterconditioning, first outside and around the clinic, then inside. We'd keep sessions very short and want to take them slowly. But because the vet is a place of business with clients, we of course again want to check with them that working on this is okay. Finally, if your dog is extremely stressed by the vet, it is always okay to discuss with your veterinarian to use medication before visits. Whether it is just as a long-term management solution or to bring down their stress levels while working on getting them more comfortable around being at the vet, there's nothing wrong with using anxiety medication to help an appointment go much more smoothly for us and our vet and much less stressful for our dog. And this isn't just a trainer's point of view. We spoke with a veterinarian to get their opinion on this topic, and this is what they had to say.
Hi, I'm Dr. Sandlin. I am actually Steffi Trott's veterinarian. I've been a practicing veterinarian for the most part of the last 23 years. And I really care about the patient's comfort and happiness when we're in the exam room in the clinic. If your dog's anxious at the veterinary clinic, it's nothing to be embarrassed about. We see it very often, probably most days, we have a pet who's anxious or nervous at our clinics. It's not your fault. In the veterinary clinic, there are just a lot of different smells and noises and sights. There's a lot of sensory input for a dog who has a very acute sense of smell and hearing, and sometimes it's just a bit much. Also, the genetics of your dog may play a role in how nervous they are at the clinic. You know, we see the happy-go-lucky golden retrievers who are completely calm and relaxed, and other breeds are not so much. The age at which your vet was first taken to the veterinarian may be a factor. So please take your puppies to the veterinarian between 6 and 8 weeks of age. They need to get their vaccines and try to make it a really happy experience. Usually the vaccines in most dogs, they don't seem to notice too much. It's almost like you just gave them a little pinch. So don't worry about the pain from the injection. It just goes under the skin and shouldn't make them too sore. Shelter and abandoned dogs or stray dogs may tend to be more anxious. They have higher rates of separation anxiety, and pets with separation anxiety are more likely to be anxious in the clinic. So that's just something we have to deal with when we have these kind of pets. Pandemic puppies, often not exposed to many new places, and they were not socialized as thoroughly as a dog that was born before or after the shutdowns. So we just need to work with them to get them used to going to a clinic. If your pet's nervous at the vet, you might see signs of lip licking. The tail may be tucked between the legs. They may hide or crawl under the exam room chair. Some of them will even shake. And these are just ways that you could tell if your pet is nervous. Things to try before the veterinarian visit to help out would be food. If your pet is food motivated, bring your pet to the veterinarian hungry, just like you would before a training session. And then during the exam, treat for calm behavior. And you can also use the food to lure the pet into a position that the vet needs it at. If your pet is diabetic or a very young puppy, say under 5 or 6 weeks, talk to your veterinarian before fasting. Certainly you wouldn't want to give a dog an insulin injection and then fast it. That would be not correct. If your dog has areas he doesn't like being handled, please let us know beforehand. Some dogs don't like their ears touched, they don't like their hind end touched. Just let us know. Most veterinarians would probably examine that part of the body last so that he doesn't get all riled up during the exam. At home, it's helpful to get your dog used to being handled before you go to the veterinarian. So, on a regular basis, gently lift up the lip and look at the teeth, massage and move the ears a little bit, lift the tail up and handle the feet. Also, run your hands over the dog's body everywhere just to get the dog used to being touched this way. Also, if you do this, you might find medical problems and be able to detect them earlier, because you would make a veterinary appointment if you found something wrong. Sometimes people try over-the-counter prescriptions. They may or may not work. If you have tried them and they've failed, please ask your veterinarian for a prescription drug. Remember that the supplements, the over-the-counter supplements that you can get at the pet store, they're not FDA regulated. They may or may not be safe, and they may or may not be effective. So just keep that in mind. When your dog is medically managed with a prescription for anxiety or anxiousness in the clinic, the doctor can do a more thorough examination. The staff and you and the pet are safer because the dog is more relaxed. These medications are only temporary and they'll wear off usually by the end of the day. Asking for medication, or if your vet suggests medication, does not mean that you're a failure as a pet owner. Some dogs just need a little bit of help. Consider the medication as a tool to help your dog become more relaxed and happy in the veterinary setting. And really giving your dog a medication for anxiety at the clinic is not all that different from getting a prescription for pain or any other disease that your dog has. I would just like to end with a quote from a veterinary behaviorist, Dr. Vala Parthasarathi. To that end, psychotropic drug or pharmacological medications is any drug that has a significant effect on the psychological processes such as thinking, perception, and emotion. When it comes to our companion animals, that change in emotion is really important, because one of the things that I and other veterinary behaviorists like to say is that a dog's or cat's or horse's perception is their reality. What they are perceiving, what they are feeling, that is their reality. As we implement behavioral treatment, we're talking about how we can change that reality so that they can feel more relaxed. Often that involves changing their emotions so they can feel comfortable in these situations that are typically making them uncomfortable. Thank you for listening to this video.
We hope you found this video helpful on how to navigate vet visits in the future. If you have any questions, please feel free to reach out in the comment section down below, and a member of our training team will be happy to help you.